Good day, everyone, and thank you for joining us today. I am Muraitu Shiminina, the Global Coordinator of the UNFPA-UNICEF Joint Program on the Elimination of Female Genital Mutilation. I have the honor of launching the 2021 Annual Report, Delivering and Sustaining in the New Normal, which highlights the overall Phase 3 performance analysis of the UNFPA-UNICEF Joint Program on the Elimination of Female Genital Mutilation, accelerating change between 2018-2021. We are all indeed living in a new normal today, where gender equality is going backward. Girls' and women's lives are getting worse, from humanitarian crisis to choice around sexual and reproductive health, climate change to their personal securities. Amidst these challenges, our resolve to adapt and continue our efforts to eliminate the practice of FGM needs to be sustained and strengthened. The 2021 annual report outlines the achievement, challenges, opportunity in the efforts led by UNFPA-UNICEF to eliminate FGM. It showcased the program's commitment to shifting approaches, creating positive impact, and contributing to the 2030 agenda. I am proud to share some of the joint program key achievements in 2021. We had more than 3.4 million individuals across 4,475 communities engaging in public declaration of female genital mutilation, supported by the joint program despite the COVID-19 pandemic. More than 500,000 girls and women received health, social, legal services related to FGM services. 17.6 million people were engaged through social media promoting FGM elimination, and 198,437 adolescent girls completed capacity development package, empowering them as change agents in 9,234 communities. Now allow me, on behalf of the joint program, to present the 2021 annual report video launch, featuring the artwork of Mr. Roland Zenga, Regard d'Espoir, Glances of Hope Peace, from the Democratic Republic of the Congo, which captures the 2021 achievement of the joint program through his brush and powerful voice to emphasize on the role of men and boys in our collective movement to end FGM. Without further ado, ladies and gentlemen, please take a moment. Thank you.
Working for a world where everyone finds their place is all of our responsibility. Humanity is making progress every day in terms of equality and security, but so much still remains to be done. So many walls, barriers, obstacles still remain to be overcome. Female genital mutilation, this age-old scourge, is declining. It is losing ground with effort and action of people determined to give back to girls and women a hope for the world of tomorrow. It is everyone's duty to work towards building a world where everyone has a place free from violence and let everyone use their brush to draw a fairer world. The UNFPA-UNICEF Joint Program on the Elimination of Female Genital Mutilation through concerted action has resulted in significant progress and contributes to realizing this fairer world. For the joint program, 2021 was a year of great achievements. Now, we see 4 clear and convincing results. First, a conducive environment has been established for the elimination of FGM at all levels while respecting human rights. Legislation is being strengthened, and various countries have been coordinating in this direction. Of the 17 countries where the joint program implements, 14 have laws that criminalize FGM. The number of evidence-based costed national action plans to end FGM rose from 8 in 2018 to 14 in 2021. Ministries and several other sectors are coordinating to put an end to this practice, and many social actors, such as faith-based organizations, are also involved. The second result is that girls and women are gaining autonomy in terms of expressing and exercising their rights. They can act to change mentalities with a view to ending FGM. Since 2008, millions of people from thousands of communities have publicly declared their wish to see this harmful practice disappear. In 2021, over 3 million people made public declarations against FGM, a 30% increase from 2020. Similarly, over 4,000 communities made public declarations on eliminating FGM, marking a 48% increase from 2020. The UNFPA-UNICEF joint program, through media grants, has strengthened and supported the action of several local activists. Everyone says no to FGM. In Somalia, Ethiopia, Kenya, Nigeria, Mali, Guinea and Gambia, the work of hundreds of activists and campaigners has been funded. In 2021, thousands of monitoring systems were installed in several communities in various countries. Over 80% of communities have established oversight structures after publicly declaring their support for the elimination of FGM. In 2021, community-led protection systems were established in almost 4,000 communities, a 46% increase since 2020 and the highest since 2018. In its Phase 3, the joint program met and even exceeded the objectives on the use of social media. During the COVID-19 pandemic, social media was used as the most effective method to mobilize people and provide opportunities for online civic engagement, inform about access to services related to sexual and reproductive health rights, and provide overall support for the elimination of FGM. In 2021, the joint program and its partners supported 17.6 million social media engagements. The joint program has strengthened the involvement of men and boys to eliminate FGM by emphasizing positive masculinities. Since 2018, the joint program has exceeded the target number of intervention areas where men and boys from various communities have been advocating for ending FGM. In Phase 3, comprehensive sexual education has spread widely within the communities. The number of other life skills and development training has also increased. During this phase, more than 500,000 girls were able to escape FGM. The third result is that more than 500,000 of girls and women received quality services in terms of prevention, protection, and care related to FGM in a systemic and appropriate way. The COVID-19 pandemic has not stopped the number of girls and women who have received medical, social, and legal services related to FGM from growing. This positive trend indicates improvements in the accessibility and overall quality of these services. The fourth outcome is improved capacities for countries to generate and use evidence and data to develop policies and improve programming. By 2021, all countries have used data and evidence to improve policies and programs aimed at ending FGM. In 2021, a synthesis of data on evidence on FGM was developed. This conveys key findings on the quality and strength of existing data on FGM. From this, a 5-year program was developed. Evidence gaps are described, research priorities established, and approaches that enable adoption and use of the evidence data. Through the continued work of the UNFPA-UNICEF joint program and its partners, particularly positive signs point to a downward trend in the practice. Over the past 3 decades, the prevalence of FGM has fallen from 1 in 2 girls to around 1 in 3 girls. The joint program has developed the program document for Phase 4, which will take place from 2022 to 2030 within a decade of action to achieve the commitments of the Sustainable Development Goals in the elimination of FGM by 2030. The UNFPA-UNICEF Joint Program for the Elimination of Female Genital Mutilation, Delivering the Global Promise, is generously funded by the governments of Austria, France, Iceland, Italy, Luxembourg, Norway, Spain, Sweden, United Kingdom, United States of America, and the European Union.
Good morning, good afternoon to everyone who has joined. My name is Nankali. I'm a senior advisor for child protection at UNICEF headquarters. I'm so proud to be a part of the launch of the 2021 annual report this morning or evening or afternoon, depending on where you are in the world, including the overall Phase 3 performance analysis for the joint program today. UNFPA and UNICEF since 2008 have been jointly leading what is definitely and continues to be the largest global program to end FGM, delivering against the Sustainable Development Goal 5, Target 5.3. I would like to first acknowledge and thank Roland Zanga, the artist from Kinshasa, DRC, who has beautifully curated the artwork we have just seen. Secondly, I would like to thank each and every one of you for your individual roles in the elimination of FGM, whether it's through your participation in the joint program as a government, religious or traditional leader, as an activist, and of course, as part of CSOs and NGOs on the ground, on social media, etc. I would like to equally thank the donors of the joint program who have shown so much leadership on this issue for decades. None of these commitments nor our responses would be possible without their continued generosity and vision. Big thanks to the governments of Austria, France, Iceland, Italy, Luxembourg, Norway, Spain, Sweden, the United Kingdom, the United States of America, as well as the European Union. We especially thank all girls and women for not only standing up to say no to FGM, but for giving voice to the millions of other girls and women who are at risk and affected by FGM. We commend your leadership in ending this harmful practice. As you have seen and heard from the highlights video, the joint program has made incredible progress over the years, despite program disruptions caused by COVID-19, climate change, and other humanitarian crises. We continue to be resilient in delivering what is required, and we continue to sustain in the new normal to fulfill the right for every girl to be free from FGM. I must also note that despite this progress, the overall progress to meet the global target for elimination by 2030 needs to be at least 10 times faster. Moving forward from here, you may ask what's next. Phase 4 of the joint program was launched at the start of 2022 with a vision to create a world where every girl and woman has a voice, a choice, and agency. The main objective of Phase 4 is to eliminate FGM by 2030 through accelerated and collective efforts that mobilize actors at regional, at national, and at international level. For us and the global community, the next 8 years will be pivotal, critical, especially as countries continue to steer towards a resilient and sustainable recovery from multiple humanitarian crises. Let's continue working together to end FGM. Millions of girls and women are counting on us. Thank you so much to everyone who's taken the time to be able to join us for this launch. The report will be available publicly on both UNFPA and UNICEF websites. Please read it, please give us your feedback, and have a wonderful day. Thanks once again for joining us. Bye for now.